Thanks, Brandis. A bit of a dip today in new statewide COVID cases after multiple record case hauls last week. This comes as hospitals across the state hover near capacity and as Chicago Public Schools and the Teachers Union debate in-person learning. And joining us to talk about all of this and more is Dr. Ngozi Ezike, Director of the Illinois Department of Public Health. Dr. Ezike, thank you as always for joining us. I do want to touch on the situation in Chicago here because it's front and center for so many parents. Bottom line, in your view, are schools safe places for kids and staff to be during this Omicron surge?
You know, I think it's nuanced as are all issues associated with COVID. I think when we think about what would happen in schools, completely masked environments, versus potentially what would happen if kids don't go to school, maybe congregating with some of those same classmates, maybe in unmasked conditions, I think you might have more mask compliance in the schools. And for sure, we know that when kids are not in school, we have educational losses, behavioral health losses. And so in terms of the teachers, you also know that we know the ways that we can keep people safe with vaccination, boosting, and masking. So I think we can make that school environment safe. I know that Omicron is highly transmissible, but we have to think of the whole picture about what's at stake when the kids are not in school.
And no doubt there's been enormous challenges to remote learning, but I do want to show a graphic that the Illinois Department of Public Health, and this is from contact tracing, statewide, schools are overwhelmingly the number one place for potential exposure. Now, this excludes the Chicago region. What does that data tell you?
There are some significant limitations to that data, because if you ask anybody at any time, where are you most likely to have been in the preceding days where you would have been exposed, the top two are always going to be work and school. And so that's just a factor of where people spend the most of their time. That doesn't signify that schools inherently are unsafe. It's just when you poll all the people, where were they most likely to have been? Of course, they were at work or they were at school.
And the Chicago Teachers Union has made testing a key component of some of their demands to go back to the classroom. CPS acknowledged that it turned down the SHIELD test, the saliva test developed by the University of Illinois, in favor of antigen testing. What do we know about the efficacy of SHIELD versus antigen testing in detecting Omicron?
So we know that the saliva-based test through SHIELD is a molecular-based test. And we know that antigen tests, the lateral flow assays, they work through different mechanisms. We do know that molecular tests have a measure of amplification, so you can find the fact if someone has the virus or not. We know that the antigen tests are very useful when you're dealing with symptomatic individuals. That's when they're best used. So there are different situations where one test is at its best and is more reliable than other times. That all kinds of testing is needed because of the cost, the timeliness of turning around the results, accessibility, and then if you have to do rapid numbers of testing, there might be things that you have to consider between those choices. So again, there's no one size fits all. It's a very complicated issue. There aren't enough tests for all the people, in our state, for all the testing that we'd like to do, given this highly transmissible
That said, the state is providing 330,000 antigen tests for CPS to purchase. Now, will that go a long way to alleviate at least parents and teacher concerns here about being in the classroom?
I don't think that just having that one, set of tests takes everything away. I think we know that we want to have kids in the classroom if this is what is necessary to get kids back to in-person learning, where they can get the social emotional benefits, where they can get the educational benefits, then I'm so glad that we're getting one step closer to getting our kids back in school and minimize those deficits, especially the equity deficits, where we have disproportionately more affected, Black and brown kids throughout our city.
And though black and brown kids are also less likely to be vaccinated right now, at least in Chicago public school system. I want to talk statewide. We saw numerous days with case hauls in the 40,000s last week. Today, 19,000. Are you confident we're at or near a peak here with this Omicron surge?
I don't think there's an opportunity to be confident with this pandemic. We've been thrown lots of curveballs, so it's not. I don't think that my crystal ball can predict exactly. I'm hoping, that as quickly as this quick rise has come, that it will also peak and be coming down. We can't determine that from just a day or two. We need to have a trend going in the right direction. We are hoping that we're nearing there if we're not there just yet.
And we mentioned the capacity situation in Illinois hospitals, hovering around 90% of ICU beds occupied right now. Do you believe that it could get worse and that demand could outstrip supply at some point soon?
That is the fear, and that is what we are working aggressively to try to not get to that point. But with less than 10% of ICU beds and almost the same situation for regular beds, there is a concern that any patient, whether it's a car accident and you need emergency care for car accident injuries versus a heart attack, there's no bed for anyone. And so we need to limit the number of COVID admissions, and we're at about 700 COVID admissions a day. We need to limit the number of those by having people get vaccinated and boosted, which significantly decreases that. We need people to get their flu shots so they don't end up in the hospital with a flu admission. And then we need to do all that we can to stay away from the ER for just routine measures that could be handled at an outpatient, or don't show up at the ER just to get a COVID test. We want to make sure that we allow the throughput that's necessary through our ERs and hospitals so that emergencies can be tended to in as minimal amount of time as possible.
And as you know, we've talked to a lot of hospitals that say that they are already starting to delay some non-essential procedures right now because of this situation. We'll have to leave it there. Our thanks, as always, to Dr. Ngozi Ezike. Thank you so much for joining us.
Thank you for having me.